Thank you so much for your time, everybody here. I really appreciate it. And thank you so much for the staff and all the volunteers here who are prepared to testify. Imagine being in the shoes of a parent. And imagine your child needs a root canal. And your family is relying on mass health. This concept that Dr. Rizkallah has already mentioned about minutes to a provider is a false narrative. Let me share with you the realities. Many GPs do not provide endodontic treatment. Those that do, the far and the few, are fully booked for months. Our dental schools, Tufts, BU, and Harvard, are picking up the slack and doing the best they can, and even then, the wait lists are for months. The FQHCs either can't provide endodontic service or have waiting lists for months. What happens to the child? What happens to your child? He or she suffers. Oral infections are life-threatening. So why is this occurring? Why is it that a kid on Mass Health can't get endodontic services treatment on time? Because Mass Health has failed to ensure that the payments are sufficient to enlist enough providers so that care and services are available under the plan, at least to the extent that such care and services are available to the general population in the geographic area. This is not an option. This is the law. Mo has mentioned that already. Now, imagine being a Mass Health dental provider. These are our heroes. They are our true heroes. They have served through bureaucracies, seeing the most vulnerable, seeing those that others would not see. And for them, since 2009, EPSDT codes across the board increased 0.2%, while inflation has increased 45% during this period. Yet, we choose to serve. I ask you why. It's simple. Your Mass Health providers care. Since the pandemic, there's been a shortage in staff, hygienists, assistants, and dentists. Despite the low reimbursements, Mass Health dental practices, Mass Health providers are expected to compete in the marketplace for staff. If Mass Health pays $53 for an adult cleaning, and the fees paid to a hygienist is in excess of $60 per hour, how is this going to work? How do we expect our Mass Health providers to continue to provide care when they're losing at every single procedure? It is unreasonable. It is not that we're asking for a fee increase. We're asking so that we can provide care to our patients. Now I'm going to switch gears to our Mass Health dental director, Samantha, and Blue Twin. They have been some of the greatest advocates I have ever seen. I've advocated for Mass Health now for 20 years. These are some of the greatest advocates and assets that we have in the Mass Health system. But how do we expect them to do the job when we are not complying with federal law in terms of reimbursements? We're not even complying with realities. How do we expect that? My name is Abe Abdul. I am the president of the Massachusetts Dental Society, and I carry with me the voice of over 5,000 members who are all eager to serve. Please, I beg of you, allow us to serve. Allow us to protect Mass Health. Allow us to protect our patients. Allow us to provide care to the most vulnerable. I will be providing my written testimony, and I thank you once again for your time.